Now this is just a little odd stain here to sort of give you the obvious difference between goblet cells and mucus cells. But I would never use this for an overall identification. What happens here is that the stain will stain goblet cell mucus a kind of magenta color, whereas mucus cell mucus will be dull. Just a little bit hazy, but not nice and magenta. Now you do know what these are, right? So don't let the staining throw you. These are villi, so it's got to be small intestine, right? That's the start. And that the little magenta bubbles are goblet cells. And that it's a special technique to show the special mucus that goblet cells make. Whereas you compare it to these here. See, it's just a little fuzzy, not nearly as intense for the stain. These are mucus cell clusters in the submucosa. You know them better as Brunner's glands, which are just your stock mucus cells, just like salivary. So where is this? Yeah, specifically it's got to be duodenum if you know those are Brunner's glands. Only to show the difference between goblet cell mucus, which is fine and much more complex than mucus cell mucus. The Rolls Royces of mucus production, the Hugos. Just wanted to reinforce that difference. You cannot use mucus cells and goblet cells synonymously. That is a no-no. Did a little extensive dissection here to remove the surface of the liver to show this from an anterior view. Could you tell what this structure right here would be? Well, it's multiple. That's the porta hepatis. Yep. This is everything in and out of the liver, hepatic artery, portal vein, and then you even got your CHD curves around. Here's your gallbladder, your cystic duct would be right in there, but I wouldn't ask you about it here. It's not well demonstrated. Inside of the stomach, what are these? Yeah. Stomach was completely empty, so you get really nice rugae. It's folds. Out here, spleen upper left. Now, I did this actually in collaboration to show this, which I consider far more important than anything demonstrated on this specimen. And here you are coming out the lower end of your stomach with this curvature right there. Would be duodenum, right? Curving to the left. And that what I want you to see here is a tissue that starts right there, socked up against the inside curvature of the duodenum. You'll see it continue underneath your stomach here, and it continues to see it out here, all the way at the spleen. So that's one of the best presentations you'll ever see of the normal positioning of this organ, which is the human pancreas, which is usually torn off the back wall and hanging out here. As far as the normal presentation of this organ, this is the best you'll ever see, other than cut yourself open and look at yourselves. Okay? Yeah, I might give a few points for that. self-dissection to find your pancreas. So I'd like you to always keep it in mind that the pancreas is plastered against the posterior body wall underneath your stomach. Even to the point where someone has pancreatitis, and then this causes pain in their pancreas. What's often an area they come? So where is this from?
Liver.
Liver. Sure, all the way. A little magnified with a central vein. You got your cords, got your sinusoids. What's this? In the sinusoid? Kupffer cell. Yep. So these are Kupfers if you see nuclei sticking in those sinusoids. But this is just crestal violet, just a different stain turning it blue. But that shouldn't throw you. Still has everything to tell you it's got to be liver. Closer section, more magnified, but you still should know the compartment.
Colon.
Yeah, I'm getting good now. It's flat, no villi, crypts, bubbles. Goblet cells, a great slide for goblet cells. Dominant. So that's got to be colon. Okay. Name this salivary tissue. So what are you going to go with? Or which of the three salivaries? And then you're thinking, do I see all serous? Do I see almost all serous with a little mucus? Or do I see a lot of mucus? Yeah, a lot of mucus. At least half of it. These are serous. Half of it are mucus cells. Gotta be sublingual. What's this? That's a demilode. There are little cap of serous cells on the mucus. Still has demilodes. So that's what you're thinking about to tell which salivary tissue you're looking at. One of those intercalated ducts. And your last instructions, got to cover everything these days. Have a metal detector standing in